MPox is caused by a virus related to smallpox and manifests with symptoms such as high fever and skin lesions called vessels. The disease was first identified in the Democratic Republic of Congo in 1970 and had mostly been confined to a dozen African countries. However, it began to spread more widely in 2022, reaching developed nations where the virus had not previously circulated. Superintendent Dr. John M. Conteh mentioned that more cases have been recorded recently.
Well, of course, as we know, monkeypox, it's a viral infection. It don't affect people. But one thing I can assure you is that Sierra Leone we are prepared. Not to the first time monkeypox of Ghana. They don't come to 1970 and 1919 about that. It came. This 2019, sorry, this time around they don't come back. Right, waiting the government don't put in place through the public health agency, we get isolation center. One of them are hospital, police hospital. And so if a patient comes, we send out that the outside they go to the test. And one inside they do the test because you know they need to outside you do the test lab for behind the specialized. And when I do the test, you're diagnosed positive, then we send you to one of the isolation centers there. And one of the isolation centers are here. So when the patients come, we treat them and we discharge them. So far, I can assure them only 2 death cases we don't get. Well, it's very, very cordial. But in addition to the Ministry of Health, we also get the Public Health Agency, when headed by Professor Fodisa. They work closely with me when it comes to public health emergencies. So before this thing happen, they don't take some of the staff them, they don't send them on training, they don't go do training how for prepare for them kind things, they are always kind of intervention for take, and they always they can for provide all the support and logistics. So for instance, not to be ambulance in the usual, then get the special ambulance team with the camp for care with patient and also for discharge patient. So we're working in tandem with the question. So when we don't diagnose you, so you're positive, we choose the public health people and we're in charge of that. We will dispatch you to the various isolation center. And so let's say the capture, because we get the amount of beddings then, we get for now 16 beds available for that. If the bed don't flow, we tell it to bed don't flow and care what I say. But any of the 16 we get nurses then, we get doctors. Let me say that one of the doctors then when they see the patients then. When they see them, when they give them medicine in the morning, the afternoon, night, we ensure that we support them in all kinds of because when it comes to MPox, you treatment not to just medical, supportive treatment, when the person don't get better free, they get fluid, the person they get pain, they get pain medicine. And so we do all that treatment and when the patient don't recover, we discharge the patient.
Dr. Conteh also emphasized that to ensure the safety and security of the general public, it is essential to adhere to the Ministry of Health's measures for effectively responding to the current MPox situation.
That's another good question. Well, first for the Ministry of Health, then they do the sensitization, and anybody who you see suspicious of MPox, so they get the alpha pox and among them, they get fever in the hospital. And when the hospital provision don't be made already, they go send you at the center, outside they do the test. For when our police hospital, in fact, if you follow up to them, we don't do start sensitization with the Inspector General of Police that is sponsored. We go right down all police stations, we sensitize them about this disease, how you get them waiting for the waiting of photo. Yeah. So if patient dey any sign, for we like the police and so, all they need for that for just call me, we contact the public health authority, then we send ambulance there, and they come at the appropriate isolation center. The symptoms then not they confirm say positive, it is suggest say you're positive. And the test now they confirm that get that clear. But what are the symptoms dem. You get the generalized symptoms the way common with other sickness dem. Headache, the person go dey feel severe headache. You go dey feel say the joint and the heart. You go feel extreme tiredness. The person go dey scratch all over im body. They say the body dey scratch and everything. Those are the generalized symptoms. And they get what we call lymphadenopathy, wey the person go dey say I get grind, wey you get so you dey get plenty in it. But in addition to that, when it comes to MPox, you dey get the, you know, like a person get chicken pox, then small boil all over your body, and they come all over your body, including your private parts. They comot a massive one. And when you begin see them thing, you don't begin give you an idea. Say this can be MPox. But the advice is don't wait until it come out. This is very much important. Number one, if you get MPox, you don't know so you get am. If you listen an ordinary sick, you dey shame, you go treat yourself. Wetin dey happen? You know that for well, you likely go die if you not treat am. Although it is self-limiting, some of them meant for themselves. Yeah. But the other bad thing you do, you dey risk people wey dey near you, you pikin, you wife, you workmate, you dey spread the sickness to them. Imagine if on all 10 year there on all get am, how it will affect the country, how it will affect the economy. You understand? So the moment you feel that way, just come to hospital. When you come and the police will open, you come with do the test na free. With the sending at the center, when they do it, they treat you, and it's all free. So please, don't say, I will go prepare doctor myself, yeah? Because another bad thing is, if not say you get other sickness then, like tuberculosis, HIV, diabetes, or you have a low man, if you get MPox, it adds to it, it make them sick as a lose. So do ya. When you feel them, no shame, no hide, calm, and we will do the right thing, and we will teach you.
On Wednesday, Sierra Leone initiated vaccinations for frontline healthcare workers, high-risk individuals, and children aged 12 and older. This preventive MPox vaccination campaign was launched after the country secured 61,300 doses from the World Health Organization and developmental partners. As previously reported by the NPHA, Sierra Leone has recorded 125 cases of MPox, with 29 females and 96 males, along with 71 active cases, 52 recoveries, and 2 fatalities. The declaration of a public health emergency in January aimed to combat MPox and announced an increase in surveillance borders. For Incisive TV, I'm Victoria Khadija Bangura reporting from Freetown.